So we're here to talk today about the flu. As we know, flu is a very prevalent disease, especially this time of year. We have people coming in all the time sick and worried about it. And the flu is a very serious topic. Most people, normal, healthy, young individuals, it's maybe not be a huge deal. You might get over it and be perfectly fine. But there are definitely people who are at risk for complications of the flu. Several people, and I don't have that number, but flu kills people every year. So it's important that we protect the people who are at high risk for the flu. So number one, how do we prevent the flu from spreading? Number one, get your flu shot. Everyone over the age of 6 months is available to have the flu shot, and they should get that flu shot. The flu shot, there are some side effects and there are some bad information that gets tossed around about the flu shot. However, side effects are typically mild. Side effects of the flu shot are typically the result of an immune reaction, which is actually what we're hoping to achieve with the flu shot. That's what signifies that you're actually getting some protection from that. So the most important people to receive the flu shot are people older than 65, people that are pregnant, children above the age of 6 months, people who have asthma, COPD, heart disease, congestive heart failure, any of those big bad diabetes, any of those big bad chronic conditions makes you more susceptible to having complications of the flu. So one of the most important parts of the flu shot is you're not only protecting yourself. A lot of times as young, healthy individuals, we kind of brush it off because it doesn't make us that sick. You don't feel that bad. We get over it. But the problem is the loved ones you're around, maybe your children that are under 6 months and can't be vaccinated, maybe your grandmother, maybe your grandfather, maybe a loved one who has a serious condition. Those are the people that we vaccinate for, because those people, even though they may have the vaccination, they're not as protected as the rest of us. So you need to get your flu shot to make sure those around you are safe. There's a 6-foot area of transmission around somebody with the flu. So that's a lot of people that we come in contact with. So it's very important that we're protecting ourselves and our loved ones by vaccinating against the flu. Another appropriate action to make sure we're maximizing safety in our community and our household and our friends and loved ones, if you are sick with the flu, it's important that you take care of yourself to not spread it. So what do we talk about? We talk about washing our hands, covering our mouths, obviously cleaning up after ourselves with sanitation wipes and that kind of thing. But something really important that people don't always think about is mustering through it and going to work anyway. People tend to think, well, I don't feel that bad, I can go to work, no big deal, and then you contaminate your whole office, you contaminate your school. So if you're not feeling well, you've tested positive for the flu, it's important for you to spend some time at home and get well so you're not exposing everyone. It's particularly if you work in a social atmosphere where you're seeing people every day, or if you have a child that's going to school, don't send your child with the flu to school because you're just going to infect a lot of other people. So it's important to take care of yourself, get some rest. Typically you're contagious up to 24 hours after having the flu, so it's important to give yourself plenty of time to heal up and get to feeling better. So at Lifespan, we obviously have your flu shots to make sure you're getting protected. Another important thing, if you start having fever, cough, nausea, vomiting, fatigue, you're feeling achy, you just feel like junk altogether, during the months of October to March, that's prime flu season time, and it's important that you come into a Lifespan and you're tested for the flu. So if you're having any of those symptoms, it's important to get in and get checked so we can test you for the flu and we can start appropriate action to make sure we're maximizing our treatment and make sure we're protecting those around us so that we don't give it to everyone we come in contact with. So most importantly, you need to be vigilant and make sure that you're getting your flu shot. You need to make sure you're washing your hands, covering your mouth. If you do get sick, you need to stay out of the public, stay at home for a few days till you're feeling better. And if you do start seeing symptoms, you need to be proactive instead of reactive and get in, be tested by one of your Lifespan facilities. Let us take care of you and take care of yourself so that you're not exposing you or your loved ones to further complications of the flu. My name is Tyler Stanfield. I'm at the Lifespan Summer location. If you're having any of these symptoms or have concerns about the flu, get in and be seen at one of our many Lifespan locations so we can take care of you.